proud of about the Bariatric Center is we are really a team of providers of several different specialties that our whole goal is to help patients through their weight loss journey. We really recognize that every patient has a different set of goals and they need different tools to help them get to their goals. Some patients come to us and they've tried half a dozen different things. They've tried different diets. They've already tried prescription medications, and they are ready for a very strong tool like surgery, and they're ready to have that conversation. Other patients come to us and they really have never tried diet and exercise before, and so we can start with those tools. And since every patient comes to us from a different place, we have the resources to come to them at the place they are at. And that's, I think, one of the things that makes us very, very different. So rather than this being one size fits all, that every patient who walks through the door must get surgery, instead we come to what the patient needs and we tailor the program to what the patient needs. And so the first thing is really making sure that patients understand what a good, healthy diet is. And we have 3 dietitians that can work with patients and help them really understand diet. We also have an exercise physiologist because many of our patients don't understand the exercises that they can safely do. Some people need more help or a stronger tool than diet and exercise alone. The stronger tools include things like prescription medications, and so working with a bariatrician who is a licensed medical doctor, who's in our case an endocrinologist. There are right now about 6 prescription medications that can be prescribed. The New Directions program is our meal replacement option. And in that option, they can use a combination of shakes and bars primarily as meal replacements. There are actually 2 options within that program that set different calorie limits depending on how much the patient needs to lose, how quickly they want or need to lose weight. But it's not just about the meal replacements. It's a program where they work with the dietitian. It involves classes where they come in once a week and they learn the skills necessary to lose weight and to maintain that weight loss for the long term. The most common operations done at our center are the laparoscopic sleeve gastrectomy and the laparoscopic gastric bypass. The laparoscopic sleeve gastrectomy is basically a partial gastrectomy, meaning we remove part of the stomach. This is done in such a way that we use surgical staplers to remove part of the stomach, but we don't have to do any connections. So the operation takes about an hour, and most people are in the hospital for a day or 2 after surgery. The operation works through a couple of mechanisms. First off, the part of the stomach that we take out is the part of the stomach that makes the hormone that makes you feel hungry. So if you take that part out, you tend to not be very hungry for about 6 to 9 months. So if you're not hungry all the time, it's a lot easier to learn new eating habits and develop a new relationship with food. So that's one thing that a lot of patients like about that operation. It's also restrictive because the stomach is a lot smaller now. Patients can't eat as much food, so it helps them stick to smaller portions. And then the food sits there for a little bit, long enough for the brain to figure out that they're full and they don't need seconds and they don't need to nibble on anything else. And so they eat just a lot less food. And as a result, patients after a sleeve tend to lose somewhere between about 55 to 65% of the weight they need to lose. So if they were 100 pounds overweight, you'd expect them to lose somewhere between about 55 and 65 pounds. And with that comes significant health improvements. Improvements in diabetes, sleep apnea, high blood pressure, high cholesterol, sort of the list goes on and on. The other operation that we very commonly do is the laparoscopic gastric bypass. That is by far the gold standard here in the United States, and it is the most common operation for the last 20 years, and it is still the most common operation that we do. For that operation, we use surgical staplers to make a small little stomach pouch that we reconnect to the intestine. We don't actually take any stomach or intestine out. It's just rerouted in such a way that food takes a different path. It has a lot of the same effects as the sleeve. Patients tend to not be very hungry for about 6 to 9 months. They can only eat a small amount of food. They get full very quickly, and the food sits there till their brain figures out they're full. But it has a little bit extra advantage that because of the bypass part of the name, about several feet of bowel is now bypassed, which means it doesn't see food. So they don't get 100% of the calories out of what they eat, which also means they don't get 100% of the vitamins out of the food that they eat. So it does have a little bit better weight loss than the sleeve by about 5 to 10%, but it is at a slightly higher risk because since they're not getting 100% of the vitamins out of what they're eating, they have to be a little more careful about their vitamin levels. And so we have to be a little more careful about nutrition long term. Most type 2 diabetics go home from the hospital on no diabetes medication or dramatically lower amounts of medication or insulin. Improvements in sleep apnea, high blood pressure, high cholesterol, with time, gastroesophageal reflux disease, stress incontinence, joint pain, back pain, energy levels, people sleep better at night. And that's why I love what I do, and I absolutely do. I have so much fun at the follow-up appointments, sitting there on the computer, clicking off, you don't take that medicine anymore, you don't take that medicine anymore. And it is so much fun to sit there and hear about all of the medicines we've eliminated and all of the health problems that they don't have anymore and all the things that they can do that they never did before. You know, mom can ride a roller coaster that she could never ride before. Mom's willing to put on a bathing suit and come swimming, which mom would never do before. I can't even tell you how many people have told me, you know, their biggest victory was not having to fly with the seatbelt extension on airplanes when they traveled for the next time. It brings tears to my eyes when I hear the stories about how different their lives are and what they can do that they couldn't do before. To my knowledge, I am the only bariatric surgeon in a several state region who's had bariatric surgery myself. In fact, I've had it twice. I had a lap band surgery going on about 10 years ago, but then I started having some complications from surgery. So now about 2.5 years ago, I had my lap band removed and I had a laparoscopic sleeve. And since then I've lost a significant amount of weight and seen a dramatic improvement in my health. I no longer have knee pain. I've actually managed to avoid a knee surgery that I was thinking I was going to need. I work out 3 to 4 times a week. I have seen my sort of pre-diabetes resolve itself and some other health problems. So I have walked the same journey that my patients are walking. I understand how difficult it is to diet and exercise and to do this without a stronger tool. There's nothing magical about surgery. These are just tools, and they are tools that you have to use the right way.
I like to think that it's our personal connection to the patients through all these different facets that really make it possible for us to care for our patients in a specialized way. The fact that we have patients see a dietitian regularly, see our psychologist regularly, as well as the surgical team, the doctors and physician assistants, really gets us different angles about the patient and to learn who they are and what they're struggling with their weight loss. And together we can come together, talk about the different aspects of what patients say to our dietitians, who say to our psychologists, and really realize what can we do to help them, how to help them, and how we can motivate them in the future to continue to lose weight and do what they're doing to be healthy and live a happy life. Our ability to help these patients and provide a tool to really kind of refocus things and kind of help them at more than just the physical level and in the mental level as well is really satisfying, and to see patients a year or 2 years out so thankful that they've gotten so much more healthier, are able to use the tools that we provide them to lose weight and stay fit and healthy. It really makes it worth coming to work every day and do what we do here. The biggest barrier, I think, is patients thinking that, you know, their weight is something they can always worry about later on in life. Like, there are all these things going on in their life. They have to take care of their kids, their parents, they have to work, and, you know, they see themselves gaining weight and getting more unhealthy, and they're like, well, I can get into shape at some point later on in my life. I need to focus on my other issues. And they don't realize that that's such a key part of being healthy mentally and physically, when will help to take care of those other issues. And so I think that's a big barrier for a lot of patients, where they're like, you know, I'll get to this at another point in my life when I have time. And, you know, they have to realize that, you know, being overweight, having issues with obesity is something that you're going to struggle with your entire life, and you have to take that as a focal point in your day-to-day activities, as well as all the other issues that you take care of in life. We really push that you are our patient for life. You know, a lot of different weight loss programs, the surgeon does their thing, the patient after it follows for a year or two and then disappears, and only comes back if there's an issue or a problem. We don't believe in that philosophy. When you're doing well, we want to see you. When you're not doing well, we want to see you. We always want to see you regularly on a basis where we can know that you're doing the right things and you're doing well. They can find help here. One after the other patient does really well, and we can do something for them. I think that's an important part of what we can do, and I think it's just you know, everyone personally cares about the patient and wants them to do well and wants them to succeed and has their own vested interest, and I think that's important as well.
Bariatric surgery is a particular passion of mine because you are able to uniquely help people. Very rarely in medicine are we able to cure people of their diseases. Bariatrics is one of those fields where you can actually cure people of their problems. It's incredibly rewarding. I think some of the little stories that you hear, or some things that you don't think about, are incredibly rewarding. The first time that a patient told me that they could bend over and tie their shoes on their own. The first time that someone said that, you know, that they could sit back and their back would touch the chair. You know, the first time that they could really walk without, you know, assistance of their walker. Those are incredibly rewarding stories. And seeing the people come into you and really take pride in themselves and looking better and looking healthier and being more active and really enjoying their life and having more of a quality of life is incredibly rewarding. They truly care about the patients. We care about them. We want them to do well, and I think part of that is that long-term vested interest in people, that you see them not just before their surgery, but you see them before their surgery, after their surgery, and long after. I mean, we follow these people for life. And I think it's that true caring about them and seeing how they do and wanting them to be successful. I think that's really what makes this program a success. Everyone's going to struggle. Everyone's going to have setbacks. But, you know, helping identify where those setbacks happen and, you know, helping them turn it around so they gained a little bit of weight back, that's okay. We can deal with that, and we can help make those changes to help put them back on the right road. And so I think that's why this program is so successful. I think that we want to see them and they want to see us. You're reconnecting with that person that you haven't seen and catching up and finding out how their life is going. It's not just about the medicine. I think, although it is looking into their health care, but it's also about catching up and seeing how they're doing. I think it's a scary thing coming in to see, you know, coming into the bariatric center for the first time. I mean, it's intimidating for multiple reasons. I think that there's a stigmata associated with, you know, just in general being overweight, and I think that the idea of having surgery is scary. And I think taking that first step coming into the department can be a big one. But we're here to answer questions and help people from the process from start to finish. And, you know, we're here to guide them through the rest of the process, and this is a lifelong process. I think we have a great team. I think we have a great department. I think that although it is scary to come in and see us necessarily for the first time, what do you have to lose? It's just a conversation. You get to meet a new group of people who are really, you know, in this to help you become a better person.